True Medicine founder, Dr. Gina Anderson, naturopath in Central Virginia, and today I'm talking about chemically induced menopause, the birth control conversation every woman deserves to hear. Have you ever stopped to ask yourself, what if the pill isn't simply preventing pregnancy? What if it's temporarily shutting down one of the most significant and sophisticated hormone communication systems ever designed? Today we're talking about something that affects millions of women, yet very few have ever had this fully explained to them: hormonal birth control. Now, before we begin, let's be clear, this isn't about shaming people for taking birth control. I took birth control, though it is something I now regret. Every woman deserves the right to make informed decisions, and I was certainly not informed. My concern is that informed consent requires knowing both the benefits and the risks, and too often women only hear one side of the story. So here's what most people don't realize. The purpose of hormonal birth control is to stop your body from doing what it was naturally designed to do. Your brain normally communicates with your ovaries through an incredible hormonal network called the hypothalamic pituitary ovarian axis. Every month, your brain releases signals, your ovaries respond, an egg matures, ovulation occurs, progesterone is produced, your cycle becomes a monthly report card of your health. But when hormonal birth control is introduced, that conversation is interrupted. The brain receives synthetic hormones that tells it everything is taken care of. You don't need to ovulate. No ovulation, no corpus luteum, very little natural progesterone production, and instead synthetic hormones take over while your natural ovarian cycle is suppressed. In many ways, this creates a temporary medication-induced suppression of ovarian function while you're using these products. But this doesn't just happen with the pill. It also occurs with hormonal implants, hormonal IUDs, the vaginal ring, the birth control patch, and especially the Depo-Provera injection, which can suppress ovarian activity for months at a time. Now, here's where the conversation becomes even more important. Ovulation isn't only about making babies. Ovulation is part of a healthy endocrine rhythm. Natural progesterone supports the brain, sleep, mood, bones, metabolism. And many women are surprised to learn that they don't produce significant amounts of their own progesterone unless they actually ovulate. Then there are the nutritional considerations. Research has shown that some women using hormonal contraceptions have lower levels of nutrients like B6, B12, folate, magnesium, selenium, zinc, and vitamin C. Now, these nutrients are involved in energy production, nervous system function, hormone metabolism, immune health, and healthy cell function. So could that contribute to fatigue, mood changes, or other symptoms in some women? It's one reason nutrition deserves to be part of the conversation. We also need to acknowledge that known medical risks. For women using estrogen-containing contraceptives, there is an increased risk of blood clots. For some women, especially smokers, women over 35, or those with clotting disorders, that risk can become much more dangerous and serious. Certain forms of birth control, particularly the Depo-Provera injection, have also been associated with decreased bone mineral density during prolonged use. And while the relationship between hormonal contraception and cancer is complex, studies have found both risks and benefits depending on the type of cancer, duration of use, and individual health history. This is exactly why women deserve personal conversation, not one-size-fits-all answers. Now, let me ask you something. If your periods are painful, if your hormones are irregular, if you're struggling with acne, PCOS, endometriosis, heavy bleeding, or mood swings, is the real question, how do we stop the cycle? Or should we be asking, why is the cycle struggling in the first place? At True Medicine, that's where we begin. We ask, is the liver metabolizing hormones properly? Is chronic inflammation driving symptoms? Are mineral deficiencies contributing? Is insulin resistance playing a role? Is chronic stress disrupting communication between the brain and the ovaries? With environmental toxins, what environmental toxins are actually affecting the hormonal balance. And instead of simply quieting the body's signals, we believe that signals often deserve investigation. Your menstrual cycle is not merely an inconvenience. For many women, it is one of the body's most important windows into overall health. And understanding what your body is trying to tell you can open the door to addressing root contributors, not just suppressing symptoms. Now, if this message has challenged your thinking and you're kind of thinking a little differently, I'd encourage you to continue learning, ask thoughtful questions, and have informed discussions with your healthcare provider. And if you'd like to learn more about supporting hormone health, rebuilding nutrient reserves, and exploring root cause approaches to menstrual wellness, then comment BC Help. We'll send you one of our True Medicine hormone restoration guides and show you the foundational principles that we use to help women support healthy hormonal balance naturally. Because your body wasn't designed to simply survive. It was designed with remarkable healing capacity. Sometimes the first step is learning to listen to what it's been saying all along. Remember, you are designed to heal. Trust the blueprint.